First of all, our postdoctoral cohort, can't say enough. I think that's so important and such a huge highlight, along with additional CAP staff and campus partners. I think it's really wonderful to be supportive, included, and just respected amongst campus and treated, like a peer and a colleague, which is really wonderful.
I think that the campus as a whole is really, really nice. The surrounding area has everything that you need, such as the beach and different amenities. Campus-wise, and there are things across the campus that make living there and studying there easier, as far as, they have over 30 restaurants on the campus. They've got gyms that we can utilize.
I like the large campus. I'm actually a fan of it. I like walking, so I don't mind it. And I like that each college seems to have its own identity, at least in my experience. It's nice walking around and seeing those different type of unique aspects to each college.
Being at UCSD, you're really able to make change at lots of different context points within a person's life. So being able to affect and support them both with their mental health, but also with their academic, in terms of being able to follow up with student affairs case manager and help them with academics, or their dean. And being in student health services, being able to talk to their medical provider. Should we get your referral over to nutrition, or for a sleep study, or for psychiatry? And so I think being able to have an impact in lots of different levels is great than maybe being solely doing therapy in a therapy office, maybe in a different type of setting.
People here have been very friendly and helpful, and it's been a pleasure to work with the students. They have been they're so hardworking and very respectful.
I really, really enjoy the interdisciplinary nature of the behavioral health role and consulting with folks. I like being asked to put on different hats at all the different times there. And I like that no one day is ever exactly the same, which I really like.
Part of the health system means that we are aligned then also with the other residents, physician trainees and others going through their residencies and postdoctoral experiences. And so what that means is that we access a variety of different structured support systems that include opportunities for therapy or specific counseling and support systems and meetings that are available.
We have really awesome colleagues to learn from, both in psychology, postdocs, and other staff, awesome medical professionals and things, folks to learn from. Has been really, really wonderful.
Establishing myself as truly a professional, no longer a student. And I think that's what the postdoc year was for me and is for me, that, I had my physical space. And so when students would come, they would come to me as almost as if I was in a private practice in the larger campus community. So it was those physical aspects of creating that professionalism and professional identity that I think was a highlight that I think in reflection is really important, especially during this final year of training.
Being able to step into this role of starting to have or feeling a little bit more of a competence in an area and being referred to and consulted with depending on that expertise.
Having gone from being fully remote, which was isolating for me and challenging, I think, then coming into in person, I think has made a massive difference, just an overall kind of like connection to the university and the culture and the overall team and the role.
The hybrid model has been very helpful, providing time to work from home as well as in person. And so some of the convenience that comes with that.
Also really loving the transportation via the trolley, and how the university is trying to create more initiatives to support staffing with taking alternative transportation as well.
There's a new trolley line that was recently built, and so that it provides easy access for folks to get down into the San Diego area.
Like that, yeah, the trolleys making things a little bit more accessible for not just students but staff as well.
Having lots of different opportunities, both within the CAPS training program, to be able to, if you wanted to do a certain workshop or a group, you'd have flexibility to be able to do that. But also just being, again, part of the larger health campus, being able to connect with different community centers, being able to be involved in just other things. There's just so many different things to kind of be involved in on a larger campus. And
last but not least, the great weather.